everyone, and welcome to our podcast. I'm really excited that you've decided to join us for this very special moment. You're about to receive some quality information regarding home care services for your loved ones. So get ready for your weekly insight of information, stories, and tips.
Hello, good afternoon. My name is Jacqueline. I am a dentist here from Colombia. So today I'm gonna tell you or explain you some important things about the oral care in elder adults. This is an explanation for the patients and also for the caregivers. So as an introduction, we will say that oral health is not separate from general health, but keeping oral health is definitely difficult and different in old age. So in order to achieve health, it is necessary old age. As their body tissues get harder, there is collection of waste products in body cells, and there is also loss of lubrication that leads to impaired functions of some organs. So first, we are going to talk about oral health status in aged people. So we will talk about nutrition, changes in salivary glands, changes in the teeth, and also aging, periodontal disease, and prosthetic considerations in geriatric dentistry. Okay, so the first one is nutrition in old age and its implications for oral care. So it's important to know that the nutrition affects directly the oral health, and the oral care also affects the nutrition. So dental condition is considered to be an important contributing factor to health and adequate nutrition in elderly people. So missing dentition and ill-fitting dentures can cause difficulty in chewing and perception of taste of food. So also we need to take into consideration that the sugar intake, as the older people usually take more soda, chocolates, candies, and food high in sugar, because it can provoke more tooth decay in those patients. So that's why we need to take in consideration the nutrition and also the dental care. Okay, now we will talk about the changes in salivary glands and salivary secretion with aging. So the presence of saliva protects the oral cavity, the upper airway, and the digestive tract, and enhances numerous processes. So the absence of saliva has many consequences to the host. So that's why the saliva is so important. So the main oral health problem of old people is the mouth dryness, and dental caries has been attributed to the reduced salivary flow. This is an illness that it's called xerostomia. It's a condition when people doesn't have enough saliva. Okay, now we were gonna talk about the changes in the teeth with aging. So those are the most common and most important changes in their teeth. So the first one is the shape, like the morphological changes that we have, that the people have in their teeth. The second one is the color. As maybe you can see, the color becomes yellowish. This is because of the process that the dentin of the teeth has. So that's why it becomes in a different color. The third one is the internal. So what does it mean? There are so many changes within the tooth as their pulp and the blood supply. So as there are many changes in the teeth, like in the internal structure, we will see more diseases in those patients because their dental structure has been changing. So they are more prone to have periodontal disease, tooth decay, gum disease, and many others. Also, I know you can you have heard about aging and periodontal disease. So periodontal diseases are among the most prevalent chronic conditions in dentate older populations. So there are several epidemiological surveys that have found that the prevalence and severity of periodontal disease increase with age. So as I told you before, changes in structure and function of the teeth during aging may affect the host response to plaque bacteria and may influence the rate of periodontal destruction in older people. And the last topic that we are going to talk about is the prosthetic considerations in geriatric dentistry. So in many industrialized societies, more than the 50% of the elderly population are edentulous. So we have three determinant factors that affect the course of the prosthetic treatment. So the first one is the debilitating diseases. So as a consequence, people often totally neglect oral and prosthetic care. The situation may have serious implications in providing satisfactory dental care. So the prosthetic treatment should be postponed until the person's general health is restored, because otherwise the patient is not willing to make the treatment. The second one is the oral physiological changes. So what does it mean? It means that there is an atrophy of the masticatory muscles because they reduce their chewing efficiency. So it is important to advise the person on how to keep an adequate diet that is easy to chew. And the last one is the mental changes. So the presence of mental disorders in elderly patients may complicate the outcome of the prosthetic treatment. So that's why we need to take into consideration all of these determinants before we take these people to make a treatment with the dentist. And now that we know these conditions and those changes, we are going to talk about the preventive dentistry components. So we have the three more important ones that are mechanical plaque removal, the rinses that we can use, denture care. So the first one we will talk about is the mechanical plaque removal. So the most used method of brushing for most elders is circular brushing with soft toothbrush. However, when people have some conditions, they need to change those techniques. So for example, the first one is gum disease. When people have gum disease, they need to use an extra soft toothbrush. They need to use light pressure when they are doing this process, and they need to modify the brushing method. Also, there are another condition that is called diminished manual dexterity. So when people have this condition, they need to use, it's better for them to use electric toothbrushes or manual brushes that have been adapted or customized for each person. So it's important also here to talk about the water pick. It's very common that people use this device. The water pick is a device that they can use in zones of your mouth where they have difficult access. So the water pick is a water pressure device that aims a stream of water at your teeth. So a water pick can help remove food particles from your teeth and might help reduce bleeding and gum disease. But remember that the water pick is not generally considered as a substitute for brushing and flossing. So you also need to keep using your toothbrush. This water pick is just like an extra help for your oral health. Now we will talk about the rinses. So a therapeutic rinse contains an agent that is beneficial for the tooth surface or oral environment. So the therapeutic rinses may contain chlorhexidine, sodium benzoate, and fluoride, or other remineralizing agents. They can enhance oral disease, and they should be recommended to the elderly people when appropriate. So remineralizing rinses can be used in an elderly person who keeps experiencing new coronal or root carious lesions as a consequence of the xerostomia, the condition that I explained you before, that is when you stop or when you don't produce enough saliva. Okay, the next one is the denture care. this is very important because elder people used to have denture devices. So the most important thing here is to let them know they need to remove the denture when the patient is sleeping at night. So many people don't like to remove the denture at night because sometimes they are sleeping with someone else. So they say that they don't want them to see them without the denture. So they don't usually remove it. But it's very, very important for the caregiver and for the family to know that it's better for them to remove the denture at night when they are going to sleep. The second one is cleaning these appliances in a way that is effective. So the immersion of the denture in cleansers is the recommended method that ensures safety against damage of the denture material. And the last one is that the patient should be instructed always to brush and rinse the denture before and after soaking in immersion cleaners. Okay, so now knowing all of these, I will give some tips or some recommendations for the caregivers related with the oral health of the elder patients that we have. So first, there is something that it's called counseling and education. So it is a split in education and motivation. So first, they need to be educated. That's why I mentioned all of the diseases and all the conditions, all the changes in their oral cavity, because they need to know what is gum disease, they need to know what is tooth decay, they need to know what is periodontal disease, xerostomia. So with this knowledge, they will be aware of their personal situation or their personal condition, and they can take action on this. And the second one is the motivation. So now that they have the education, now that they have the knowledge, we're gonna take like the motivation. So how can we do this? So we have something that is tell, show, and do. So what does it mean? It means that first tell or explain the process. So you are gonna explain the client the process, for example, how to brush the teeth correctly. So you're gonna tell them, explain everything. Then you are gonna show or demonstrate the process. So you can also take your toothbrush and do the process, show them everything step by step. And finally, the client, the patient, can do or practice the technique until he or she has mastered the skills involved in performing in the process in the proper way. So those are the 3 steps that you need to follow. That will really help the client, that will have the motivation, so they will do the process, and they will do the process in the proper way. And finally, the caregivers should also keep watch for any changes to food and gum health, including sensitivity, difficulty chewing or swallowing, and new bumps, lesions, or swelling cares, as these may indicate underlying problems. And also, finally, don't forget to visit the dentist, as they can give you the proper and adequate routine to take care of your teeth and your dentures.
Thank you for sharing this moment with us. We hope you enjoyed it. Don't forget to visit our website, www.eldercaretexas.com, and follow us on social media. You can find us on Facebook, Instagram, and our Spotify channel as Eldercaretexas.